Hello students, today I will show how to do simple continuous suture. Simple continuous suture is like any other simple interrupted suture initial bite. Initially with the needle holder, needle placement like same thing in the proximal 2/3, distal 1/3, lock the needle, take the needle bite perpendicular at the entry point of the edge of the wound and go to the other side to the exit point of the opposite side of the edge of the wound. Then place a knot as like a simple interrupted suture. Then after that, don't cut the thread. Then take the continuous bites at the equidistant from the wound edge, usually around 5 to 8 millimeter from the already placed suture bite. So like that you go on continuously towards the other end of the wound. So initially what the knot which you place is called as starting knot. Then at the end, when you reach the at end of the wound, then you place to the loop of the suture material, you place a knot. So that is called terminal knot. Again same thing, usually surgeon's knot with a double throw, double loop it is done, and usually reef knot should be applied. So starting is starting end knot like a simple interrupted suture, then continuously take the bite unto the other end of the wound, then to the loop you take a knot, to place a knot, that is called terminal knot. So starting knot, terminal knot, it is hemostatic actually, and it is quicker you can place, and wound edges aposes very well. So very commonly used suture, especially softer tissues, muscles, fascia are closed by the simple continuous suture. So I will demonstrate how to do that. So I am demonstrating now how to put simple continuous suture. So when you put simple continuous suture, initial method is same. Hold the needle holder, lock it, ring finger, thumb. Needle should be in the proximal 2/3, distal 1/3. Needle should be placed properly. Lock it adequately. That's very important. Then take the needle bite perpendicular to the entry point. Then let it come out. Then hold the needle with the needle holder again. Pull it adequately. Then again bring it from the exit point, almost same distance like this. Now see that same distance you have to bring it out. Like this. Now see that this entry point and almost distance should be equal. Now again I will give, this is the tail end or trail end, this is the leading end where you make loop, this is called bait. Now again hold in the parallel, fold parallelly like that, needle holder, then to the bait. I am doing the surgeon's knot, 2 loop I am taking, then I will put the knot to the one side like this, and I am putting the again reef knot, put it like this, then I will put one more throw, 3 half knots, so make it more secure. Then other end, you are supposed to hold this end, and this is called starter knot for the continuous suture. Hold it like this actually, keep it like this with the artery forces, and I will start taking bite one by one through this. See that? Bite again, half. Now next bite you can take, if you are comfortable, take together. Otherwise, take it differently. That's important. One by one you can take. If you are comfortable, take together. Like this. It comes like this. Then continuously I will place like this. It should be parallel to each other. See that? It should parallel. Like this. So like this, and one more bite I will take. I'm just demonstrating. See that? Like this. One more I will take. It should be equal actually. It should be equal. It should be equal. And now this is the terminal knot. This is the starter knot. Now this is the terminal knot I am applying. See that this is the loop I will take. Again terminal knot will hold like this. This is the this becomes a trailing end. This is the bait. This is the leading end. Where always I will put a knot like this. I will put a surgical knot again. Again I will put a surgical knot, and with the surgical reef knot, of course, like this. So loop you take and then make a terminal knot. This point is important. Starter knot and terminal knot. This is important. Usually three knot is sufficient, or three half knot. So like that you have to. That is how exactly you will do the. You will do the continuous, simple continuous suture, then cut it. Now here important thing is, this is the starter knot, this is the terminal knot. So ideally it should be parallel to each other, same correspondingly should come. So it should come, and here terminal knot comes to the loop. This is the starter knot, this is the terminal knot, this is the continuous suture. So I hope students we have understood this, how to place simple continuous sutures.